So at this ASCO meeting, I'm presenting on the result of a randomized study of targeted treatment, Dabrafenib plus trametinib versus chemotherapy in children with low-grade glioma associated with a BRAF V600 mutation. So it needs a bit of background, obviously, about low-grade glioma, about the mutation. So low-grade glioma is by far the most common pediatric brain tumor. It is benign, it is low-grade, but the behavior is very diverse, depending on a number of factors. First, resectability, whether the tumor can be removed or not. And second, the response to treatment when the tumor cannot be resected. And the common treatment in pediatric low-grade glioma when tumor is non-surgical is chemotherapy. The response to chemotherapy is very variable, and there are many factors that can affect the response, and in particular the molecular biology of the tumor. And within the spectrum of molecular alteration, BRAF V600E mutation accounts for 15 to 20% of the mutation and is associated with a lower response to chemotherapy, a shorter response to chemotherapy, and a higher risk of transformation to higher grade glioma. So in this context, drugs that target BRAF V600 mutation that have been developed first for melanoma patients and non-cancer patients have been tested in this tumor type. And we have conducted phase 1 and phase 2 studies that have shown safety and efficacy. So this was the last stage of the study, which was, is this combination of Dabrafenib and trametinib better than the standard treatment? So this was the rationale for this randomized study. And this was an international study that was conducted in Europe and North America, and with a profile that was a 2-to-1 randomization, 2 children treated with targeted treatment versus 1 with chemotherapy, a total number of 110 patients. And the principle was to treat patients who were chemotherapy or treatment naive as a first line treatment. So the study accrued over a short period of time, over a period of 2 years, and we have now a result after a follow-up of nearly 19 months. So the results are very, very exciting. First, I have to say that the criteria that have been used were very stringent. We used the RANO criteria, but there was also a central review that was very, very stringent. And I will present the result from the central review. There is some discrepancy between the investigator-assessed response and the central review. That is causing some issue. But basically, what we see is a clear benefit of the targeted treatment versus chemotherapy in many aspects. First, in terms of response rate, with a response rate which is 47% in the targeted treatment arm versus 11% in the chemotherapy arm. Response is more than 50% and up to complete response, but when we see the decrease in tumor size overall, we also see a large difference with nearly a 90% decrease in tumor size in the targeted treatment arm versus around 60% of the tumor that decrease in size in the chemotherapy treatments. When we look at the event-free survival, the event-free survival at 1 year is 66% in the targeted treatment arm versus 26.1% in the chemotherapy arm. A major difference which shows that for the first time we can see that a targeted treatment is providing better result than chemotherapy. The safety profile is also interesting to look at. The toxicity of the chemotherapy is essentially, on hematology, neutropenia, anemia, and thrombocytopenia, whereas the toxicity of the targeted treatment is mostly a general toxicity, fever, and also skin reaction that are classical with this type of medication. But when we look at the quality of life that has been measured during the study, we see that the quality of life of the patients who are on targeted treatment has been stable throughout the study, whereas the quality of life of the patients who are on chemotherapy had seen a gradual decrease. So overall, we can say that this is the first ever randomized study of targeted treatment in children with low-grade glioma or in children with brain tumor, that for the first time is showing a clear advantage of the targeted treatment. Very exciting prospect because we can anticipate now a gradual switch from the standard chemotherapy management to a more targeted treatment in pediatric low-grade glioma. The first one is this subgroup of patients with the BRAF V600 mutation, but we can anticipate that there will be more to come because we know that there are many other alterations that are seen in pediatric low-grade glioma and targeted treatment that can be used for this, using the same design as this randomized study. And I want to say that it's not really specific of the pediatric population, and that's also an important message because life doesn't stop at 18 years old. In fact, when we look at this population, first, we can see that these patients with the treatment that we offer live longer and their life expectancy is relatively good. They may need treatment during adulthood if the tumor is still active. But we also identify, and we have identified in a number of adult patients with low-grade glioma, the same characteristics as we see in pediatric low-grade glioma, with also a number of patients who have the BRAF V600 mutation. So the result of this pediatric study can certainly apply to adult patients. So we hope that this will be taken into account when the drug will be considered for approval, that it's not going to be limited to a specific population because this is more a broad result that can also impact on the general neuro-oncology practice.